Alright, sex chromosome disorders. There's three of them we're going to talk about. First one is Klinefelter's. And this is a XXY. So how many chromosomes is there? It's the extra one. There's normally 46 plus 1 is 47. And what is the sex? It's going to be male or female. Remember that if there's a Y there, the patient's going to be male. If there's no Y. If there is no Y, patient's female. And here I think there's two defining features here. First, it's going to be a very tall person with very long extremities. That is key defining feature 1. You have to memorize that. Key defining feature 2 is testicular atrophy. I'm going to understand this. I think this explains the rest of this patient's symptoms. So we'll think about what happens with the hormones with testicular atrophy. So first of all, testicle is made of 2 cells. Remember, Sertoli cells goes down because it's atrophied, and decreased Leydig cells. Now, do you remember what hormones Sertoli cells normally make? They normally make, remember that kind of detail one, inhibin B. Remember what inhibin B does? It normally blocks FSH. So you're actually going to increase the FSH. And now let's look at Leydig cells. There's decreased testosterone. And so LH goes up, and LH will stimulate estrogen because LH stimulates both androgens as well as estrogen. So this is the key thing. So now you have increased estrogen and increased FSH, and that, to me, that looks like a female. And that's what these patients look like. This is going to cause a very female-looking body. So you're going to get gynecomastia, which is breast development, gynecomastia. You're going to get female body hair distribution. You're going to get female body shape. It's called a unicoid appearance. So widened hips. You can look up a picture of this. And finally, because there's decreased testicular function, decreased testosterone, there's decreased let's go back. So decreased testosterone leads to decreased sperm production, so you get infertility. And I think this would be the third feature, but this is going to be a common feature among all the sex chromosomal disorders. So now let's go to Turner syndrome. Turner syndrome is XO. So O means that one of the X chromosomes is not there. It is not working, basically. So instead of 46 chromosomes, you have 45. And it's going to be a female or female. There's no Y chromosome, so there's a female. And Turner syndrome has this constellation of symptoms, and I'm just going to have to list them all for you, and you're going to have to memorize them. I suggest you take a look at a picture, and it will help you just remember some of them. So first, the short stature. They're really short. And second, they have streaked gonads. What that means is they don't have real ovaries. The ovaries it's not really developed. It's like a streak of tissue. And so that leads to decreased estrogen. And so you're going to see increased LH, increased FSH. You don't have to memorize that. You already know that based on the knowing that axis. And this decreased estrogen basically means that they have this premature ovarian failure, so they're going to have symptoms of menopause. And we will talk about that in the next lecture. And also infertility. But infertility, they're going to have amenorrhea, so no periods, which is again a symptom of menopause. And then there's going to be some heart symptoms, heart defects actually, So the most common one is bicuspid aortic valve. And the second most common is coarctation of aorta. And these are two things that you just have to memorize. You're going to have to know it. So coarctation of the aorta what happens to your pulses. Your lower extremity pulses are going to be less than your upper extremity pulses. Because let's draw out that aorta. there's these vessels out here, and you're going to get coarctation right here. So this blood usually supplies the lower extremity, and these vessels over here supply the upper extremity. So you're going to get more blood going to the upper extremity than the lower extremity, so you get greater pulses in the upper extremity. And finally, you get lymphatic defects. So there's a couple of symptoms that's going to arise. You're going to get a webbed neck, because there's extra lymph in the neck, so it becomes widened. And then you're going to get lymphedema in the hands and the feet. And then finally, you're going to have a shield chest. That's a wide chest. And there's going to be no breast because, again, there's no estrogen. And finally, you can get a horseshoe kidney. So, unfortunately, this is a bunch of symptoms that don't really make sense to me. They're all due to because there's loss of the X gene. There's some genes on the X chromosome, that are important for all these symptoms, and you have to memorize all these. And the key things are that they're going to be amenorrheic, so infertile. They're short. You're going to see this webbed neck a lot. It's going to tell you pretty much it's Turner syndrome. And then the other things you have to remember are lymphedema. You have to remember those heart defects because you're going to get asked about them. And then the shield chest is also pretty identifying of Turner syndrome. So now we're going to go to our last thing. Looks like it didn't erase, but we can go to number 3, which is called double Y male. So that already tells you it's going to be X, Y, and Y. There's double Y. Extra chromosome means 47. And again, from the name, it's a male. And this is just like, if you think about what makes a guy, just double that. Okay? They're going to look normal. They're going to be very tall because guys are normally taller, but they're going to be extra tall, but phenotypically normal. So that means that a lot of times these patients don't get diagnosed because there's nothing obvious about it, nothing obviously wrong. Undiagnosed. Okay? But they're going to have symptoms of, basically, if you think about a guy has acne, so there's going to be very bad acne. That's just all those extra androgens. You're going to have aggressiveness. They're going to be very aggressive. And guys are kind of dumb, so learning disabilities. I'm sorry to all my guys, all my dudes out there. That's the stereotype. And so that's it. So there's 3 sex chromosomal disorders that we just covered. It's Klinefelter syndrome, which kind of makes sense. Remember the key findings were the tall, long extremities. This is a summary, by the way. And then the other thing is testicular atrophy. And then we can get everything else from the testicular atrophy. They just get a feminine type body. And then Turner syndrome we talked about, which was due to it's streak gonads, and there's that constellation of symptoms that you have to remember. And I suggest you look up a picture of how these patients look like to help you remember in your mind. Finally, we have double Y males. Basically, they look normal. There's nothing obviously wrong with them, but they're like extra dude, like super guy. Okay. All right. So that's it.